Mixed cryoglobulinemia is a rare disorder characterized by the presence of cryoglobulins in the blood. Cryoglobulins are abnormal antibodies that clump together at cold temperatures and dissolve after rewarming. It classically presents with a triad of palpable purpura, weakness, and arthralgias. Because of its association with hepatitis C, it is an important small vessel vasculitis to know for board exams. In this video, I'll give you my visual mnemonic to help you remember all the details of this syndrome. Whoa, where am I? Looks like I'm in a cryo chamber? I guess I've been asleep in this cryo chamber for a while now. Coincidentally, the cryo chamber helps me remember mixed cryoglobulinemia. You know, cryo for cryoglobulinemia? Makes sense. Now let's figure out why I woke up from my sleep. Are those giant hippos inside those cryo chambers? Maybe they're doing science experiments in these cryo chambers to make some sort of super hippo. I definitely want to be out of the way of that hippo when it's hungry. Anyway, these hippos help me remember that mixed cryoglobulinemia is due to viral infections, particularly hepatitis C. Get it? Hepatitis C? Don't forget this, it's high yield. So how does this occur? Say a patient has hepatitis C. In response to this, the patient's immune system will develop antibodies against the virus. This is all well and good, but in mixed cryoglobulinemia, the patient next develops antibodies against the initial antibody. That is, against the anti-hepatitis C antibody. More specifically, the second antibody is an IgM rheumatoid factor. A rheumatoid factor refers to an autoantibody against the Fc portion of IgG. In this case, the IgG is, of course, the anti-Hep C antibody. Brr, it's cold in here. Notice the frost on the cryo chambers? Let this frost on the cryo chambers help you remember cryoglobulins. That's right. The IgM that attacks the anti-Hep C antibody is actually termed a cryoglobulin. This is because it forms immune complexes that precipitate at cold temperatures. Since multiple immunoglobulins are involved in the immune complex formation, namely IgM and IgG, the disease is termed mixed cryoglobulinemia because there is a mixture of immunoglobulins. It is this immune complex formation that causes the signs and symptoms seen in the disease. Since immune complexes accumulate, the disease is therefore a type 3 hypersensitivity reaction. And speaking of immune complexes, doesn't the frost itself kind of look like immune complexes? Furthermore, you should also remember that IgM forms pentamers that kind of look like snowflakes. The frost here should help you remember that the cryoglobulins are IgM and that they form immune complexes that precipitate at low temperatures. Now, before we move on, I also want to mention that you may see lowered levels of complement proteins, particularly C4. Here's how I like to think about it. IgM binds to the anti-Hep C IgG, which therefore activates complement via the classical pathway. C4 is therefore consumed in the process. Next, let's touch on how cryoglobulins differ from cold agglutinins. Cold agglutinins are also autoantibodies, are also IgM, and also react at cold temperatures. In contrast to forming immune complexes, however, cold agglutinins instead bind to red blood cells. Upon IgM binding to RBCs, the RBCs clump together, or agglutinate. The complement system is activated, and the RBCs ultimately lyse. In summary, cryoglobulins bind to other immunoglobulins, which clump together and deposit as immune complexes. In contrast, cold agglutinins bind to RBCs, which clump together and lead to hemolysis. Next, take a look at the small puddle of water in front of me. At Pixorize, we use small bodies of water, like puddles, to represent a small vessel vasculitis. And yes, mixed cryoglobulinemia is primarily a small vessel vasculitis. This means that the immune complexes primarily accumulate in small vessels, such as the small vessels of the skin. What's that on my hands? Droplets? Must have gotten there when I woke up. These droplets should help you remember the palpable purpura seen in mixed cryoglobulinemia. This is due to the immune complexes accumulating in small cutaneous vessels. Make sure not to confuse this with Henoch-Schönlein purpura, which is a vasculitis that mostly occurs in kids and exhibits abdominal pain. But no abdominal pain here. The classic triad you should remember for mixed cryoglobulinemia is palpable purpura, weakness, and arthralgias. I mean, I definitely feel weak from hibernating in that cryo chamber for so long. I wonder how long I was in there for. You can remember weakness by remembering how tired I am emerging from my long sleep. I definitely have some arthralgia and joint pain too. Patients with mixed cryoglobulinemia can have other skin manifestations as well, such as necrosis due to accumulated cryoglobulins. If patients have symptomatic cryoglobulinemia, they are advised to avoid and protect their extremities from exposure to cold temperatures. Whoa, check out these frayed wires. It looks like one of the wires powering the cryo chamber frayed, waking me up. These frayed wires should help you remember peripheral neuropathy. In fact, peripheral neuropathy is one of the most common symptoms, so don't forget it. Check out those glowing tufts coming out of the cryo chambers. They seem to be feeding the hippos. These weird glowing things can help you remember that mixed cryoglobulinemia causes glomerulonephritis, which is of course due to immune complex deposition in the glomerulus. Glowing tufts for glomerulonephritis. I think I've had enough of this mysterious voyage. Let's recap and get out of here. Mixed cryoglobulinemia is a small vessel vasculitis characterized by the presence of cryoglobulins in the blood. These are autoantibodies that bind to hepatitis C antibodies, resulting in immune complex formation. The immune complexes precipitate at low temperatures, which is where cryoglobulins get their name. Since the disease is caused by accumulated immune complexes, it is, therefore, an example of a type 3 hypersensitivity reaction. Clinical manifestations include the classic triad of palpable purpura, weakness, and arthralgias. It may also lead to glomerulonephritis and peripheral neuropathy. Now we're really done. Till next time.